He was the smart one. I was always jealous.
It's not easy for Jessica Ferguson to talk about this.
My family member is loved, grew up in a great home.
She's speaking out about her younger brother, Chris.
He's not a monster. He never was a monster. He wasn't violent.
Do you think this tragedy could have been prevented?
Absolutely.
It was June 2023. Gilda and Bruno D'Amore and Gilda's mother, Lucia Arpino, were killed in their Newton home. The couple was supposed to renew their vows for their 50th wedding anniversary.
They weren't in church, and somebody came to see if they were okay.
After their bodies were discovered, investigators warned the public to be vigilant.
This is the night to lock your doors and windows, even if you do not normally do that.
Prosecutors say surveillance video from a nearby home reveals it was Christopher Ferguson with no shirt and no shoes, staggering and appearing disheveled. He knew none of the victims, who prosecutors say were stabbed and beaten to death.
None of this had to happen. None of it.
You all tried to get him help.
Yes.
Repeatedly.
Repeatedly.
Jessica says it was preventable if any one of the many mental health clinicians and hospitals she asked to help her brother in the months before the attack had stabilized his spiraling mental health crisis. Christopher Ferguson is bipolar, according to court records.
This, in my opinion, is a complete failure of the system of, letting people with severe mental illness fall through the cracks and end up being criminalized for having a disease they did not ask for.
This is not an isolated case.
Ann Corcoran is executive director of the National Shattering Silence Coalition, which works to improve the lives of those affected by severe mental illness. She and Jessica are pushing for a new law in Massachusetts to create a continuum of care for severe mental illness, also known as AOT, Assisted Outpatient Treatment. It would allow a judge to order someone into outpatient treatment.
We are one of the last 2 states in the entire country without this law.
Corcoran says the Ferguson case shows why the law is desperately needed in Massachusetts.
Families are trying repeatedly to get their loved ones help and are told there's nothing they can do until somebody becomes dangerous.
But the bill has its critics, including mental health advocates who agree the current system is broken.
The system is not doing the job, but the way into that problem isn't by court mandating the person who is already suffering.
Sarah Davidow has struggled with her own mental health. She has serious reservations about AOT.
So I think there's 3 big reasons. One is, we have to ask the question of, is AOT effective? Even if it's effective, will they implement it ethically? And then 3 is, do the treatments that they want to force work?
Yeah, we're releasing him today. And I was like, I'm sorry, what?
Jessica Ferguson is remembering her brother being released from the hospital again days before the Newton killings.
This is the 3rd time in 4 months he's been in the hospital. No. And they're like, yeah, there's nothing we can do.
She says something needs to change.
By failing these families, they're failing the community because they're allowing people to deteriorate. And when people are in psychosis, you just don't know what may happen.
The bill remains in the Senate Ways and Means Committee, and the clock is ticking. The formal legislative session ends at the end of July. Christopher Ferguson is being held at Bridgewater State Hospital awaiting trial. Mike Bodette, 5 Investigates.